Good evening. Hello, everyone. Welcome to our first webinar for 2025 on behalf of the National Optometric Foundation. We welcome you to another episode of Protecting the Vision. And tonight, we're going to talk all about glaucoma, what it is, the concerns that you may have, and we are also going to be taking questions. So if you're watching this webinar live here on our YouTube channel, you can ask questions in the comment section. We invite you to put those questions in there, and our guest speakers that I'll introduce later on will be glad to talk about those concerns that you may have when it comes to glaucoma. January is Glaucoma Awareness Month, and we want you to be aware of glaucoma. It is one of the three silent killers that we highlight as a part of the National Optometric Association to make sure that we are educating the public and making sure that you do not lose your sight because of glaucoma or hypertensive retinopathy or diabetic retinopathy. So we ask you to tune in and don't just keep this webinar to yourself, but share it. Share it with your family and friends so that they too can be educated when it comes to glaucoma. I'm excited to have them on with us tonight. But let me tell you a little bit about the National Optometric Foundation. We are a nonprofit organization, and we are the financial arm for the National Optometric Association. We try to support the association in various ways. We try to support students who are in optometry school, thinking about going to optometry school. They're in high school, looking for a career, and we try to partner with them and give them an intro to what optometry is all about. Those who want to go to our conferences that we have each year for the National Optometric Association, it's going to be in Ohio this year in 2025. Looking forward to seeing a lot of you in Ohio with us, but we try to help them to attend the conferences so they can have an intro into the National Optometric Association. And we want to thank all of those who donate and allow us to be able to do the great things that we do year in and year out. Thank you for your donation. Thank you to our sponsors. Thank you so much for allowing us to be able to be a blessing to the community, to be able to educate the community, to be able to support students that's in optometry school and make sure that we are doing our very best to preserve vision. I also want to highlight the fact that if someone's thinking about being a speaker on one of our webinars here for 2025, we do welcome you and ask that you would give us a message below in the comment section, or you can email me at timoteo3131@gmail.com. Just want to put that out there. It is also MLK Day. We are so thankful for the contributions that the Reverend Dr. Martin Luther King Jr. has given to our world, to our society, and we continue to remember him and all of his contributions. And we want to just take a moment to say thank you, Dr. King, for what you have done. We will continue to remember him as the years go on. Now, as we get into our webinar, we want you to be reminded that if you would like to donate and allow us to be able to do the great things that we're doing here at the National Optometric Foundation, we do have a Cash App. Cash App is $ Protecting the Vision. You can give a donation, big or small. We will accept them all. Thank you in advance for that donation. If you would like to learn more about us and what we do and see our board members, you can go to our website. We have a website, www.nationaloptometricfoundation.com, and we welcome you to go ahead and visit our website, get that information. We have photos on the website as well. And we're also on YouTube. Our YouTube channel is under the name National Optometric Foundation, as well as our Facebook page. It's also National Optometric Foundation. And we'd like for you to go and like our page there, follow us on YouTube, so that you can be attached to us and connected to these awesome webinars that we are going to bring to you for free in the year of 2025. All right. Thank you all again for tuning in for this episode as we talk about glaucoma, all about glaucoma during Glaucoma Awareness Month here. So we have a great guest speaker. Her name is Dr. Sophia Johnson. She's an optometrist at Advanced Eye Care and Aesthetics who graduated from the State College of New York College of Optometry. She trained in comprehensive eye care, ocular disease, contact lens fitting, as well as pre- and post-operative management. Dr. Johnson does research on the effect of breaks on the symptoms of DES, which is digital eye strain, and to determine the optimal length and the frequency of these breaks. In developing the optimal timescale, this will lead to developing an advanced-based clinical recommendation to improve the lifestyle and the visual efficiency of millions of patients. Thank you, Dr. Johnson. In her free time, Dr. Johnson enjoys working in organized optometry as an avid member of the National Optometric Association. Thank you again. And an immediate past president of the NOSA, that's the National Optometric Student Association. She also enjoys mentoring young adults, traveling, watching sci-fi shows, and spending time with family and friends. Dr. Johnson, we are so excited for you being on the show and all that you're going to share with our listening audience. Welcome to our show, Dr. Johnson. We're so glad to have you on here with us today.
Thank you for having me, Dr. Brown. I really appreciate it. I'm excited to be here and excited to talk about glaucoma.
Yes, thank you so much. And I'll bring you back on the show in just a moment. I'm going to go ahead and introduce our second guest speaker for tonight. They're going to be on together, tag teaming when we're talking all about glaucoma. And this is Dr. Issa Prude. She graduated from Nova Southeastern University College of Optometry in 2024, where she earned her BS in Vision Science and her Doctor of Optometry degree. She is currently completing a residency in primary care with an emphasis in low vision at her alma mater. Dr. Prude has a passion for service and public health. As a student at NSUCO, she held several positions in the National Optometric Student Association, including National Vice President and National President during her third and fourth years. Thank you so much. After graduation, Dr. Prude stayed active in the organization and joined the National Optometric Foundation. Thank you again. And became a board member as the NOSA and NOF liaison. Dr. Prude is also pursuing her Master of Public Health degree with an anticipated graduation in May of 2025. She intends to use her knowledge and experience to continue to expand optometric and low vision services in her community. Dr. Prude, we are so excited to have you on the show, tag teaming with Dr. Johnson. Thank you so much for being on the show, Dr. Prude. Thank you so much for being with us today.
Good evening. I'm happy to be here.
Excellent, excellent, excellent. So we're going to go ahead and dive into the show because I know that this is a topic that we try to always highlight as part of the National Optometric Association because it's one of the three silent killers of the vision, and you guys may talk about that later on. So don't let me ruin anything for you. You can still mention it. But I'm just excited to have you guys start out 2025 talking about it and sharing. And I just want to start out just asking you all if you could just tell our listening audience briefly, what is glaucoma?
Okay, I'll take that one. So glaucoma is a disease of the optic nerve. The optic nerve is in the back of the eye. We have a back wall of the eye called the retina. The optic nerve is also there. And if our eye pressure is too high, it can press on that optic nerve and cause damage to that optic nerve. And that damage is really slow. And what it affects is the periphery, the outside parts of your vision. And so we want to catch glaucoma early. And most of the time we can do that with what we see in the eyes. So regular eye exams. You're going to hear that a lot tonight.
Yes, yes, we know that glaucoma, as you said, affects the peripheral vision. It damages when damage happens to that optic nerve in the back. It's a slow progression of that peripheral vision being damaged and returned there. A lot of people wondering, does it matter? Does glaucoma matter? Should I be concerned? What's your take on that?
Yeah, so I think it's important to address that it does matter because it's one of those things that takes your sight away slowly and you don't notice it. So when we say the peripheral vision, that means our side vision, the vision that we don't usually pay attention to. So we just want to make sure that we're paying attention to our eye health so that if we're losing our side vision, we're aware of it, and that's what happens in glaucoma. So it does matter because when that vision is gone and it's really gone, you'll care about it.
Right. Yes. We also always emphasize on this webinar, the webinars previously, for people to get annual eye exams. We try to tell them, don't delay, do it today. So I just want to put that out there again for our listening audience there as we talk to you today about glaucoma. We want to talk about what it is. We want you to be aware because January is a month set aside for glaucoma awareness, and we want to make sure that we are educating the public. We have two great speakers with us, Dr. Issa Prude and Dr. Sophia Johnson, and they're sharing with you about glaucoma. So if you guys have questions, feel free to put your questions in the comment section as they continue to highlight this topic, glaucoma, silent but blinding. What's that topic is all about? If one of you can do an emphasis on that title there. You know, we talked about it a little bit. I just want you guys to just highlight that title for me.
So just to talk about it a little more, silent being something that you don't notice. So it's that vision that's out here. So when you're focusing straight ahead, it's usually nice and clear. But with glaucoma, the damage that happens in the back of the eye, we're showing a little bit here the example that Dr. Johnson said earlier with the optic nerve. So the optic nerve looks a little bit like a donut. So the donut on the left side is what a healthy optic nerve might look like, with a little hole in the middle. As glaucoma starts to progress, that hole starts to look bigger and bigger. And that bigger hole is just showing us as eye doctors that the cells in the back of your eyes are starting to die. And when those cells in the back of the eye start to die, that is when that silent but blinding vision is happening. Those cells are the ones that are used for the side. So on the far left of the bottom picture is just a little bit of the change where the donut's getting a little bit bigger. And it gets bigger and bigger until we get to that severe one that's on the right. So that is the blinding part. When we get all the way to the one on the right, it's not just the vision on the side, but the vision right in front of you as well.
And those images at the bottom there, how can we see that? Is that something the patient can see? Is that something that the doctor can see? How can the doctor see those three images on the bottom there to look at that optic nerve?
Yeah. Can everyone hear me okay?
Yes.
Good. All right. So we actually take this picture with something called an optos or retinal camera. You may have heard those words at your eye doctor's office, or you may even see an ophthalmologist. We also can take these pictures with an OCT, which is just a fancy word to say we can see the layers of your optic nerve. And so we will show you these pictures most of the time. We'll say, hey, you know, your optic nerve or your donut looks like this. And we don't want it to get any larger. And then we will talk about some treatment methods and some ways to kind of prevent some of these things from happening and from it, you know, getting to the severe cupping portion. But optos, which is just a picture of the back of the eye, retinal camera picture, and also special imaging so we can see the layers of the back of the eye.
Excellent. Thank you, Doc, for sharing that with our listening audience there. Some of them are listening. They've heard the word glaucoma. They may have even heard mom and dad mention it from time to time, or grandma. Maybe some of them are caretakers and they've taken a family member to their appointment to see their optometrist, and they heard this word, but they weren't quite sure if they should be concerned. Can one of you speak, or both of you speak about the risk factors and who should be concerned when it comes to glaucoma, if it's running in the family?
Yeah, so I can mention that a little bit. I'm sure Dr. Johnson can add on a little bit. If you hear that your family member has glaucoma, then you're somebody who might be more at risk for developing it as well. So a direct family member, like a parent or a sibling, has glaucoma, you definitely want to make sure that you're getting checked regularly. Everybody should, but you're at a higher risk. We also have a higher risk for those who have African American descent or African descent are more likely to be diagnosed with glaucoma as well. So if you have any combination of those things, we want to be more aware of it.
And does it necessarily mean, you know, so if a family member has glaucoma, am I automatically assumed to have it as well? Or
Not
just
automatically assumed. You just do have a higher risk. So we want to make sure that we're getting our annual checks, or even a little bit sooner if your eye doctor suggests coming back sooner, but really adhering to whatever follow-up schedule the person who's taking care of your eyes lets you know. So then you just come back sooner. But no, it's not automatic. If your mother has it or your father has it, you don't automatically have it.
Okay, good. And I know we haven't discussed this or talked about it, but if someone's listening, what can they expect, as far as returning time to go see their optometrist or ophthalmologist if they are diagnosed with glaucoma, or they're going to start doing follow-up appointments with that? What can they expect as far as when they have to go back? Because we've been telling people to get their eye exam every year. And if there are no issues, then 1 year, 2 years, might be okay for that next annual eye exam. But if they are a suspect for glaucoma, or they were diagnosed with glaucoma, will anything change, or will they still see their optometrist in 1 year?
Yeah, I can go ahead and answer that. So most of the time, the follow-up will be between 3 and 6 months, depending on if you're a glaucoma suspect or if you have glaucoma. And I'm glad you mentioned the glaucoma suspect portion of it, because that's something that we haven't really touched on tonight. And if you've heard of glaucoma from your doctor or someone, you may hear as well that you might be a suspect for glaucoma. That means that we have not yet fully diagnosed you with glaucoma, that you have risk factors for it, like the ones that Dr. Prude talked about, and also that there's something in your eyes that we're seeing that may say, hey, just like these cups in front of us right now, in the donut shape, this looks a little suspicious for glaucoma. Let's take a better look into this. Let's do some additional testing. Let's recheck your eye pressure, which is really important to glaucoma, and let's see if you actually have this disease.
Good.
We just want to take a second because we've given a lot of information so far. Does anybody have any questions or anything that they want clarification from what we talked about?
Check in our YouTube channel here now. Not at the moment coming up there. So if you guys got additional information you'd like to share, that would be great, because I think this is kind of leading me into where I was going to try to see, how would vision be if somebody had glaucoma? Because I'm talking about it being a silent killer of your vision. Then we talked about losing your peripheral vision. So kind of leads me into what I see on the screen now. How would their vision be? What can they expect, when say they have glaucoma?
I can actually just rewind it just a little bit to talk a little bit about more of the risk factors with glaucoma, just to add on to what Dr. Prude, and then I'll get to the vision portion. I believe that also, if you have thinner cornea, so the cornea is the front surface of the eye, and it has an average measurement. And if that measurement is smaller, then we're going to take a little bit more closer look into if you're a suspect for glaucoma. If you have diabetes, you get migraines, you have high blood pressure, or any type of blood circulation issue, these things can also put you at risk for glaucoma. As well as if you take long-term steroid medications, or you even sometimes use a steroid cream. All of these things can put you at risk for glaucoma. The reason why I do mention steroids is because it can cause an increase in eye pressure. And that's exactly what glaucoma is. If we have this increase in eye pressure for long periods of time, or kind of like a spike in eye pressure at different times, you can place that damage onto the optic nerve, and then, and as a result, have glaucoma. And so going into, after mentioning, some other risk factors, your vision, again, we lose that peripheral vision. And sometimes it's really, really subtle, right? We lose the vision on the side. As you can see, that top right picture, you really can't notice it. Looks like a little bit of a darkening on the outside corners, but really, you still have good vision there. Advanced glaucoma moves into that bottom left corner picture, and we're losing a little bit more. And then obviously we never want to get to the end stage glaucoma portion. And I think it's also important to mention is that when we take those pictures and we do those layers of the optic nerve that I mentioned earlier, and we start to see changes there, those are really, really early changes. And people don't typically experience vision loss, but this is why we want to catch it early. And the reason why we want to you know, see or test you over a period of time, those 3 months, 6 months, a year, or what have you, so that we never get to this point of actual vision loss. I see we have a question here. Do you want to take
we
that?
have a question coming in from Miss Suzette H. Miss Suzette, thank you for that question, and I'm going to allow the doctors to respond to your question there. She's asking doctors, if I took steroids for an illness, am I now at risk for glaucoma?
Yeah, so that's an interesting question. Just taking steroids on its own is not the risk for glaucoma. It is the potential for a spike in your interocular pressure. So that's that pressure inside of your eye. Steroids can cause an increase of pressure in your eye, which leads to the glaucoma. So, no, just one dose of steroids for a particular diagnosis of something, especially systemic steroids where you took them as a pill, less likely. But if you did put steroids in your eyes because they were prescribed by an eye doctor, there is something that we're going to be managing to make sure that your interocular pressure doesn't get higher.
Very good. Thank you. Thank you for responding to our question. I'm checking to see if we have any additional questions on Facebook. If you guys want to add on anything when it comes to the type of vision that someone would see when they're going through those different stages there, that's good. I didn't
There's
want
one
to.
thing I would like to add here to this particular slide. As we described in the beginning, I'm a low vision resident. So low vision is something when somebody's been impacted by a disease like glaucoma and their vision has been severely impacted. And that end stage glaucoma right in the bottom right there, that could be where someone has glaucoma. You have just a small, what we call tunnel vision. But progressive glaucoma could lead to no light perception at all, which means you don't see anything. So it's one of those really important diseases that we like to talk about, because when we say blinding, it could be completely blind. So we want to make sure that we take care of our eyes, because end stage could mean no vision.
And that's the reason why we do these webinars, guys, because we want to help preserve vision, and we want to make sure that you are educated as our patients, as our family, as our friends who are tuning in, listening to this webinar. We want to make sure that you know to get checked. A lot of people wait until they're starting to have issues before they come and see us as optometrists. And we want you to know we welcome you into the office with zero problems that you know of. Allow us to be able to do a dilated eye exam and be able to check to make sure that everything is okay, and don't delay getting that eye exam scheduled with your local optometrist. We want to help preserve your vision, and that's why we continue to have these webinars, and our wonderful doctors continue to share their wisdom with the community so that you are aware of these things, and making sure that you are also having this conversation when you go into your optometrist's office. Bring questions with you, because you may be so excited when you get there that you forget what you were going to ask. Or if you're going with a family member, take those questions with you to the appointment so that you guys can ask and receive answers about some of your concerns that you may have when it comes to your healthcare, your vision. We are the gatekeepers to the healthcare system, and most of the times, well, a lot of times, we alert your primary care doctor about things that we suspect based on what we find when we dilate your eyes and check the health of the back of your eyes. So please make sure that you get your eyes checked. Don't delay it. Make sure you schedule one for mom and dad, and make sure you schedule one for your children if you're listening to this. And sometimes we have to make sure that we get grandma and grandpa on the schedule as well there. So you don't have to have issues to go see your eye doctor. You go see your eye doctor so that we can do a dilated comprehensive eye exam and make sure that we are giving you a good report on the health of your eyes as well. All right. So just want to emphasize that, doctors, you're doing a great job. I'm looking to see if I have a question. And on our YouTube channel, there's a question from Crystal Holt. Thank you, Crystal, for the question. I'm going to give that question out to our doctors and allow them to talk about that. If you are diagnosed with the disease, will you have to undergo surgery? That's the question from Crystal. If you're diagnosed with the disease, glaucoma, will you have to undergo surgery?
I think that's a great question that we can actually go to the next topic, which was treatment, because we haven't discussed it yet. So to
Okay.
answer your question, will you have to undergo surgery? No, you won't have to. So for with glaucoma, like we said, it is an increase in the pressure inside of your eyes. So we have a couple of things that we use to try to decrease the pressure in your eyes. One of those things is eye drops. So they're just intraocular pressure lowering medications. There's different types that will have different colors of the caps and different times of day that you might put them in your eyes. But so that's a picture right there on the right of those eye drops. So that is one way that we can lower the pressure. Another way is using this, what is called a slit lamp on the left side. It's the same thing that we use to assess the health of your eyes, but there's something called selective laser trabeculoplasty, or SLT. It's just a laser procedure that's performed to change the anatomy of the eye that can help lower the pressure as well. So these are the two things that we would start with initially to lower the pressure. Now, if your glaucoma continues to be uncontrolled and the eye pressure stays continuously high using either one of these interventions, then a discussion with an ophthalmologist can be used to determine if you're going to have surgery. So the initial question, will I have surgery if I have glaucoma? No, it's not an automatic, I've got diagnosis of glaucoma, I'm going to have surgery. However, if these other interventions do not work first, then it's something that might need to be considered.
I
Thank
also would
you.
like to, thank you, Dr. Prude. I also would like to add that while surgery is an option, sometimes it's also a good option because when we diagnose someone with glaucoma and they go on drops, most likely they'll be on drops for the duration of their lifetime. And sometimes a surgery can happen one time and take 15 minutes. And you won't have to be on drops for a year or a number of years. And that's a good option for some people who may not want to take drops every day or cannot take drops for any reason. They have dexterity issues, or just for lifestyle reasons. Maybe they just have a really, really busy lifestyle, and drops is not a good option for them. We have some really great surgeons around, and even at my practice, that do some interventional, what we call interventional glaucoma, or interventional treatment for glaucoma, so that someone doesn't have to go on drops, because it can cause other problems as well. Drops sometimes cause dry eye, and that's an epidemic. And so I wouldn't hear the surgery, hear the word surgery and, be so afraid by it. We have, great techniques that are out there right now. And, it's just a conversation that you would have with your surgeon about what that will look like for you. And they can answer all the questions that you have.
Right. So, Dr. Johnson, Dr. Prude, thank you so much for those responses there. And so you're saying it varies from person to person, is what you're trying to say. And the doctor will go over the necessary course after gathering additional information. It looks like on the screen there's some testing, looks like that may be involved when it comes to glaucoma as well. Anybody want to tell us what we got on the screen there?
Yes, I can. So Dr. Johnson mentioned earlier something called an OCT, which was a fancy machine that we use to take a look at that optic nerve, that donut that we talked about before. So there's two ways that we like to measure the change with glaucoma. So that first one is the one on the left, the OCT, and that's measuring the actual donut in the eye and the cells that are there and the layers that are there to see the changes that might be happening. So those are very small changes that very powerful machine can measure. So they're demonstrating what it would look like if you had that performed for you at an eye exam. You would just be putting your chin forward and your forehead forward, and they take a picture. You just have to look straight ahead for that one. The one on the right is our functional vision test. So this is a visual field. This is testing if you've had any damage to your optic nerve and it's had any changes in your vision and what those changes are. So again, you'd put your chin in the chin rest and you'd look all the way forward, and there'll be a light at the center that you keep looking at the entire time. We give you a little remote that you press every time you see a light anywhere in the bowl. That's just trying to show us if you have had any loss of the side vision that we're testing for. And in combination with these two things of checking your structural changes with that OCT and then your functional changes with the visual field, we're able to see if there's any change or progression in glaucoma.
Okay, very good. Anything additional, Dr. Johnson? Because I may have some questions about these two devices there. I've had the opportunity to work with them as well. Just want to see if you had anything additional that you would like to add.
I would like to add that this gentleman on the left-hand side is not demonstrating properly the way to sit in this machine.
Thank you.
Forehead all the way forward, please, and thank you.
I can't tell you how many times I had to say that today with other guests in the office today. I'm like, no, that forehead must be all the way against there. Yes, absolutely. So before optometry school, I had a chance to do a lot of this testing because I worked in several optometrist offices there. And some people may be concerned, this testing is good and everything, but do you all know, will my insurance cover it? Will I have to pay for it, or is there anything additional that you can say when it comes to this fancy machine that you guys have here, this OCT and big Humphrey visual field testing?
Yeah, I would like to just say that most people who have insurance, most likely this will be covered. I don't want to say for certain that it will be. You will have to check with your insurance company. You will have to check with the office where you will be getting the testing. But if you have commercial insurance, Medicaid, Medicare, this is likely covered. And that's on the Medicare website. And, unless, you don't have any insurance at all and you are self-pay, you can ask, whichever provider or doctor that you're using, if they have a sliding scale pay program or something like that you can use in order to get this testing. I would also like to add that this testing is definitely testing we use for glaucoma. But if you're just coming in for a screening for glaucoma and you ask your eye doctor, hey, am I at risk for glaucoma? They may not go straight to these two tests. They may just check your eye pressure, which is also called IOP, to make sure that it's lower than 21. Some people have higher eye pressures above 21, and they're more suspicious for glaucoma. Also, the way that your optic nerve looks, going back to that very first slide, those are going to be the two things, as well as some other things about your general health history on whether or not they go to these two tests. But if you come in and, we're not, you won't say like, oh, I have glaucoma, or I think I have glaucoma, and then we'll do these two tests. We have to kind of go through our process. One of my professors used to say, it's like putting pieces of a puzzle together when it comes to glaucoma. You have to kind of, take every bit of information and kind of fit it all together. And so we wouldn't necessarily go straight to these tests, but these are definitely our mainstay tools that we use to, one, diagnose glaucoma, as well as treat glaucoma.
It's good. It's good. Good information that you guys are sharing with our listening audience there. Checking also again to see if anyone has questions there. And let me just see here. Got that. Okay, good. So good information that you're sharing when it comes to glaucoma. This is Glaucoma Awareness Month, and we want to prevent vision loss. We want to protect the vision. And we're so excited to have Dr. Johnson and Dr. Prude on sharing with us about glaucoma and the testing and giving you some insights in there. And I want you guys to know, if you do have any questions, you can put it in the comment section below. We're on our YouTube channel. I'm not sure if you're watching from YouTube or our website or Facebook, but you can put your questions in below and we'll try to answer that for you. Now, you mentioned glaucoma screening. Do you guys want to add any additional information about glaucoma screening before I pose the question again about how often should someone see their eye doctor?
I have something just small to add. I would say glaucoma screening really happens really at every comprehensive eye exam, right? Because we're taking your eye pressure and we should be looking at your optic nerve, and also taking your general health history. But also, there are sometimes fairs and other programs that are held, and you can get screened for glaucoma at those events as well. They're either at schools, community events, just things happening around, So if there's a table there and they're doing eye screenings or they're doing something like that, they'll probably check your eye pressure and may take a quick look at your optic nerve. And so that's also considered a screening as well. And then they'll give you the information that you need to go to your local eye doctor to see if they need to do any additional testing.
Very good. And I'm also thankful for, shout out to all of the schools who are doing their screenings out there. Not saying that you guys are going to be suspicious that a patient has glaucoma, but you at least send the children to their local optometrist when you are suspicious that they may have a vision problem there. So shout out to the schools and also the primary care facilities that continue to refer patients to their local optometrists to get their eyes checked. We're so thankful when we see children walking in, no glasses, first eye exam ever, age 7, age 8, and they have a high prescription or they have a lot of astigmatism. That's the beginning step of getting them connected with an optometrist, someone who can help care for their eyes. So just want to give that shout out to you all. Thank you. Continue to do those things because we all work together as a team. Your local optometrist working with your primary care doctors, and then we're also working with whoever the ophthalmologist we may need to refer you to if there's an additional care that's needed for our patients there. So thank you guys for that. So a question came up from Dwight Prude. I like this audience tonight. Thank you guys for not being shy and asking questions. Thank you. Dwight Prude, sounds like the last name is close to one of the speakers, but let's go. Are LASIK patients at more risk for glaucoma? That's the question for tonight, Doc. So what do you guys want to give feedback to Dwight Prude when it comes to that question?
I can answer that one. Dr. Johnson mentioned it earlier. The front clear part of our eye is called the cornea. And for those who don't know what LASIK is, it's a surgery that changes the front part of your eye, that cornea, that change it so you don't have to wear glasses or contacts. But when you change the front surface of the cornea, it makes it a bit thinner. And when you're taking the measurement for that pressure that we're talking about, it can change the accuracy of that measurement a little bit. So it is something that your eye doctor will take into consideration when they're assessing your intraocular pressure. But the LASIK itself, the surgery itself, is not increasing your risk. It's just our assessment of your pressure in your eyes.
Thank you, Dr. Prude. Any additional, Dr. Johnson? Never want to cut anybody else off there, kind of like you do in church. Will there be one more? So any additional comments on that? No. Okay. Very good. Thank you, Dr. Prude, for responding back to that awesome question. Again, I'm loving this audience tonight. We have a question from Suzette H. Suzette want to know, what is the average age for people to be diagnosed with glaucoma? Is there an average age for people to be diagnosed with glaucoma? Do we see it in children, babies, or only in adults?
Yeah, so I would say anyone can be diagnosed with glaucoma. You have pediatric or juvenile glaucoma, unfortunately, right? That affects anyone, really any child. We have some children that are blind from glaucoma at birth and or have complications after birth. I do know someone personally who has a child with glaucoma and is being managed by a pediatric ophthalmologist. And so we see it really at any age. But in terms of the average age for people being diagnosed, I would say that you can be more at risk if you're over the age of 40. I typically see it in practice in the 5th decade, 6th decade, so 50s and 60s. But really, You can be diagnosed at any age, which is why it's so important for those annual eye exams. I had a 50-year-old who came into the office for their very first eye exam. I was not expecting that, but it just proves the importance of why we're having these talks and these conversations about eyes in general, right? Not just glaucoma, but really, I would say I typically see it in the 50s and 60s and older, of course. Um, uh, an older age is puts you more at risk for having glaucoma and or getting glaucoma.
I think one thing I can add to that is that glaucoma is the disease of the optic nerve that we've been talking about, but there's many different types. So as Dr. Johnson talked about, there is the pediatric, the juvenile, the young individuals who are born with whatever reason that caused the damage to the back of their eyes. There's also different types of glaucoma that can be caused by trauma, something that happened and hit your eyes, and now the anatomy in your eye has changed, so the pressure goes up. There's also the type that you're most familiar with is called open angle glaucoma, primary open angle glaucoma, where there isn't an other reason for why glaucoma got diagnosed in your eyes. For the ones that you hear about most often, because it would be for older ages, as Dr. Johnson is saying, someone who is in their fifth, sixth decade of life. However, and that does not mean we should not get our eye exams until we're 40, 50, 60, because there are different types of glaucoma that can affect us younger.
Very good. Very good. This question that I have that came up here is like a two-part question. So we've talking about pressure going up, and we know that pressure can lead to damage to that optic nerve in the back, damage in the nerve fibers in the back there. Question is, can I go blind from glaucoma? And if I go blind, what's my next step? Are there resources out there with specializing in low vision? Is there any help for those who are in that end stage glaucoma that you mentioned earlier?
Yes, absolutely. I'm glad you asked. So yes, you can go blind from glaucoma, like we said before. And blindness can be completely with no perception of any vision at all, or you have a very small amount of vision left that makes it very difficult for you to do your daily activities. So what can we do if we get to that point? So there's something called low vision rehabilitation service. What I'm doing my residency is an additional year of training after optometry school to help assess some of the needs that you might come across from your changes in vision. That can be completely dependent on the person and the provider that you see. They'd ask you a lot of questions about what you might be having difficulties with. If it might be walking around, navigating in unfamiliar places, if it's reading, cooking, cleaning, whatever it is. That conversation is what you have with the low vision specialist, and then we show you some devices and talk about different resources that might be available to you. Some of the biggest resources I want to talk about is the Division of Blind Services. That will be different for whatever state that you live in. But if you're someone who has a visual impairment, not just glaucoma, but if you're impaired for whatever reason, the Division of Blind Services can give financial support to help with some of these devices that we might talk about at a low vision exam, as well as help with some rehabilitation to get you back to work if you're someone who's still interested in working. And then every county that you live in will have a rehabilitation center. So that has doctors of optometry who do low vision services, potentially, as well as orientation and mobility training, which would be if you ever saw somebody with a long white cane, because they're no longer able to identify objects with just their eyes, they use other tools. So you could teach them how to use the long white cane, as well as teaching how to use some electronic devices that talk to you instead of having to read. All of those things are available. So that is very important to take away if you're someone who's out there who's already been affected by glaucoma. If you have gone blind or you've severely lost your vision, there is rehabilitation out there to help you live independent and happy lives. We just have to find the low vision services that are closest to you.
Wow, that's good to know. It's always good to know that if things lead to that final stage of glaucoma, that there is still hope and still help available to our patients. There are resources available. So someone may be listening to this and they could be dealing with glaucoma and may not know that there are resources to help you financially. Financially, there are resources available. So make sure that you inquire from your local optometrist about those resources. And is there a website that they can go to online if they're not connected to a local optometrist, or maybe their local optometrist don't quite know about these resources, Doc?
So I think the best place you can start is the Division of Blind Services, because that's a
Okay.
federal organization. It's a government organization. It's different in every state, but they will be connected to the providers in the area.
Excellent. Excellent information. Love it. Love it. Love it. So you can go blind. That's the reason why we stress, even at the beginning, I said a silent killer of your vision slowly starts to take away your vision. And we want to help prevent that from happening and encourage you to do not delay getting your eye exam scheduled with your local optometrist there. Any additional words as it relates to glaucoma, what people should do, what they should be aware of, what they should know from each of you as we are wrapping up the session here. You can share that information.
I think I'm not sure if this was shared earlier, but I think is really important to share it at the end as well. Is that glaucoma is painless, right? It's painless, and you don't know. You just wouldn't know unless you go to the eye doctor. And of course, if you knew that you were losing peripheral vision or side vision, then yes, you would know that something is wrong and you definitely needed to see your eye doctor. One thing that I'd like to point out is just a small story that I heard while I was in school. It was a patient who came in and he was saying that he was having trouble, and this could be other things as well, not just glaucoma, but he ended up having glaucoma, but he couldn't see a part of his TV, and wherever he was, sitting in his living room or something like that, he never knew because he didn't go to the eye doctor. But obviously, knowing that, like something's wrong, it's not the TV, but, he needed to go. And so it's painless. And we don't want you to get to the point where you have to lose vision or you do lose vision. We want to see you before then. And so that's kind of what I want everyone to take away from this, as well as the fact that it does affect the Black community, the Hispanic community, and the Asian communities the most. And so if you may or may not know if your grandmother had it or your aunt has it or even your mother or your father, but you should still go get checked out.
Absolutely. Many times there are communities that's underrepresented, underserved, which is why I love that the National Optometric Association, and we team with them, the NOF, team with them each year at the conventions to serve where you go, providing eye exams and services and glasses, partner with VSP, providing glasses and services and check-in, screening, doing full eye exams, for the community on the spot, no matter where the convention may be. That connection is made within a community, and those services are provided there. So thankful for that. We don't want you guys to delay. Things happen. Some things happen that's not reversible. That's the reason why we keep stressing for you to get your eyes examined. So if you haven't had your eye exam on the schedule for 2025, we want to encourage you to do that. Contact your local optometrist today, probably tomorrow. They're closed probably now, unless you're on the West Coast. May still have a few more minutes there to get it in. But call your local optometrist and get on their schedule for an eye exam in 2025. And not only you, but make sure that we get your family on the schedule as well. Many times we will have parents bring in one child, and then we'll see 2 or 3 other children with them. And we will encourage them to allow us to get them on the schedule as well. And the mom might say, hey, they don't have any problem. They're not complaining about any problems. We say, that's okay. You have insurance. Let us go ahead and get them on the schedule so that we can check and make sure that we don't see something coming, down the road there. So to our optometrists who are listening, we want to encourage you to do that. If you see one family member, but they got 2 more people, 3 more with them, encourage them to get an eye exam as well. We don't know. If we don't check, we don't know. So we want to make sure that we're getting everybody in for their annual eye exam, and make sure that you stay in touch with someone who can do that dilated eye exam or take those OCTs or retinal photos that the doctors mentioned earlier on this webinar. Anything additional that you guys would like to add there? Because I'll do my own little talking, and I want you guys to continue to be the guest speakers for tonight.
I think one thing I want to add is we did talk about something that could be quite scary. Though going blind, losing vision is very scary. And you have the power and opportunity to take care of yourself. Like this information that we gave you tonight gives you the invitation to take care of your health and try to potentially stop the progression or slow the progression through some of these interventions that we talked about tonight. So it's not a lost cause. It's not if you have glaucoma that I'm going to go blind. It is I have the opportunity to do the best decision for myself and my health, for my health. And something else, the eye doctor, I hope the local eye doctor that you see is not that much of a scary place. Thankfully for us, the most thing we'll do is give you some really bright lights in your eyes. So if it's something that you're apprehensive about, maybe go with a friend, let them have their eye exam first and watch that it's just a few eye drops and lots of light. So those things are a little bit less scary sometimes. So just don't have that be the reason why you don't get your eyes checked. It's a little bit of life to make sure that we can save your vision.
Yes, probably the friendliest doctor you can go see for the year is your optometrist there. So not calling any other professional out, but you can get a little scary at some of the other professions. But going to see your optometrist will be a fun, insightful, and a very welcoming visit for you there. Dr. Johnson, did you want to hold back if you had something else to share?
I do not, but I really appreciate the NOF for having me, for allowing us to do this talk. This was fun, and it's always great to see my friend Dr. Prude and to interact with her, and to answer some of the questions from the community. I see some of the shout outs in here. I appreciate you all for coming in and listening to us tonight and chatting with us, and just making sure that you're also sharing this live, sharing the information. So really appreciate you all for having me.
Yes, thank you all for teaming together. I mean, this is quite the duo here. May have to bring you guys back later on for one of our future webinars. You did such a great job highlighting glaucoma during this month of January, Glaucoma Awareness Month. I appreciate that. And got a shout out from Crystal Hope. She said, both doctors are amazing. I really learned a lot today, and I wish them the best in 2025. And Taylor Graves here said, this was great, Dr. Johnson and Dr. Prude. Thank you so much. Suzette said, thank you guys for the great information. Dr. Larry Jones said, blessings to you all. Thank you for a great presentation. We got one more question before we exit out. Someone was posing the question, is vision loss from glaucoma recoverable? There's the leading question right there. Which one of you guys want to take that question in for that?
I can do that one. So vision loss from glaucoma is not recoverable. Like we said in the very, very beginning, once that donut has gotten bigger, we cannot make it smaller again. So that just emphasizes everything that we said tonight. So we don't want to lose any of our vision because we will not get it back.
Thank you, Dr. Prude. And on that note, folks, that's why we do these webinars, protecting the vision. That's what our main goal is, educating the communities, protecting the vision. And we're going to continue as the National Optometric Foundation to do these webinars and have these great speakers on. As you see there, we have a website, nationaloptometricfoundation.com. We're on Facebook as well under National Optometric Foundation. Go and like our Facebook page. YouTube channel, you can follow us there on our channel, subscribe to the channel, and follow us there. And if you would like to donate to allow us to continue to do the great things we're doing in the community and for our NOSA members, please do so at our Cash App $ Protecting the Vision. We had two great, amazing speakers, Dr. Sophia Johnson and Dr. Issa Prude, on sharing with us all about glaucoma tonight. We want to thank you guys for your service on this day of service, representing Reverend Dr. Martin Luther King Jr. on the day of service, and thank you for serving after your office hours there. I appreciate you so much. You did a fantastic job, and I hope that you have a great rest of the evening.
Thank you, Dr. Brown, for hosting us.
Thank you.
Thank you. Thank you. Thank you again, folks, for tuning in on our episode of Protecting the Vision as we shared about glaucoma, all about glaucoma during this month of Glaucoma Awareness Month. Glaucoma is one of the 3 silent killers of the vision that we continue to campaign on behalf of the National Optometric Association. And we want you to know, don't delay. Get your eye exam on the schedule this year in 2025 with your local optometrist. Do it today. We're so excited to have you on. My name is Dr. Timothy Brown. I'm a board member for the National Optometric Foundation, and I look forward to sharing with you next month in February with another fabulous guest speaker on our webinar here. Thank you so much and have a great evening. I'll see you on our next video.